Welcome to Footprints and Impacts, the podcast where we uncover how the environment shapes our health and well-being. Whether you're curious about how chemicals in your surroundings affect you, or you're looking for practical ways to live a healthier life, you're in the right place. Brought to you by the Environmental Health Association of Canada and the Environmental Health Association of Quebec, this podcast shines a light on multiple chemical sensitivity, MCS, the importance of healthy, least toxic product choices, and what it means for those navigating this disability, where over 1 million Canadians have a diagnosis of MCS. We're here to raise awareness, offer resources for accessibility, prevention, and build a healthier, inclusive community. Let's dive in and explore how our footprints leave a lasting impact on our health and our planet. So, hi everyone, and welcome back to Footprints and Impacts. I'm your host, Marco, and today we have an enlightening and thought-provoking conversation ahead of us. We're diving into the world of environmental health and the crucial connections between our surroundings and our well-being. Our guest today is Dr. Caroline Barakat, an associate professor specializing in environmental and occupational health at Ontario Tech University. Dr. Barakat's expertise spans several areas of environmental health, including air pollution, toxic exposure, and health across the life course. She has led impactful research projects exploring the long-term health effects of environmental exposures, particularly childhood exposure to air pollution, and the potential risks posed by chemicals in personal care products and household items. Her work is deeply aligned with understanding the intersection of environmental activism and public health, and today we'll explore how these issues intersect with the lived experiences of people with multiple chemical sensitivity, MCS. Dr. Barakat, thank you so much for joining us today. I'm really excited to have you on the show.
Thank you so much, Marco. I'm really happy to be part of your podcast.
Thank you. So, Dr. Barakat, could you start by sharing a bit about your background and what led you to specialize in environmental health, particularly in relation to toxins and pollution?
Yes, sure. I began my academic journey with a strong interest in environmental sciences and human health, which led me eventually to the field of health geography, where we focus on exploring the spatial distribution of health outcomes. We also focus on exploring the spatial distribution of determinants of health, whether it be social or physical or cultural determinants of health. My early work, as you mentioned, focused on the intersection of human health and the environment, including air pollution and toxin exposures. So the long-term health impacts of childhood exposure to air pollution, particularly for vulnerable populations, became a key focus of my PhD work. So my initial work when I was doing my PhD studies. And over time, I also became deeply interested in exploring how environmental toxins, particularly those that are in personal care products and household items, can contribute to health inequities across the life course. So this drive stems from both a personal curiosity and a professional commitment to understanding how we can create healthier environments for everyone, particularly for vulnerable populations, individuals with underlying medical conditions or health conditions, children, the elderly, anyone that has some sort of vulnerability to environmental exposures.
Thank you. And I'm sure when you mention individuals with vulnerabilities, this could be definitely relatable to multiple chemical sensitivities. So, how does your work relate to multiple chemical sensitivity, MCS? What connections do you see between your research and environmental exposures and the struggles faced by those individuals with MCS?
MCS is a condition that underscores the broader challenges posed by environmental exposures, particularly for individuals who are vulnerable to the effects of chemicals. So, my research focused on understanding and mitigating exposure to fine particulate matter and airborne volatile organic compounds, the VOCs, as well as other environmental toxins, which directly connects to the experiences of individuals with MCS. Individuals with MCS often encounter challenges in everyday environments, in their workplaces, in their homes, and in public spaces, because the presence of these chemicals is ubiquitous. Everywhere we can find VOCs in the air, as well as other environmental toxins. So, my work emphasizes increasing awareness of the detrimental health effects of these harmful chemicals, which can be toxic to the human body, and then in creating inclusive spaces and exploring how policies can better address the needs of this population and other vulnerable populations as well.
Yes, thank you. And one of your areas of expertise is the long term health effect of childhood exposure to air pollution. How might this be relevant to individuals with MCS, particularly as they navigate everyday environments that can trigger sensitivities?
Exposure to air pollution during childhood, as we have seen through a lot of research evidence, it has lasting effects on the respiratory system, but not only on the lungs and the respiratory system, also on immune function and overall sensitivity to environmental toxins. So these early exposures can predispose individuals to heightened sensitivities later in life, which could then potentially contribute to conditions later on in adulthood, such as maybe asthma, COPD, and multiple chemical sensitivity. So, for individuals with multiple chemical sensitivity, everyday triggers such as air pollutants or household chemicals or scents, perfume, chemical products may exacerbate their sensitivities, highlighting the importance of addressing air quality and other environmental factors from an early age. So, my research seeks to identify these connections in order to inform preventative strategies and improve health outcomes over the life course from childhood on to adulthood. If we create better environments throughout the life course of individuals, we're more likely to protect their health and avoid conditions that may happen later on in life.
Hmm, thank you. It's very interesting, actually, when you think about it, the compounded exposure and how it affects people in the long term. You know,
Definitely, yeah.
you've been involved in research on toxin exposure reduction. How do chemicals in personal care and household products contribute to health problems? And why is it essential to reduce exposure for people with MCS?
So, as I mentioned, personal care products and household products, they are likely to be significant sources of exposure to the volatile organic compounds, phthalates, and other harmful chemicals. Parabens, triglycerin, they're all harmful to the human body. So these substances can disrupt endocrine function, they can impair respiratory health, and they can contribute to cumulative toxic burdens, especially for individuals with MCS, who often experience more severe reactions when they're exposed to those toxins. So, reducing exposure to these chemicals is essential not only to improve the quality of life for those with MCS, but also to prevent broader population health risks and having other individuals as well develop those sensitivities and those long-term health outcomes. So, strategies can be adopted, strategies like labeling transparency, promoting low VOC products, public education campaigns. They're all critical to reducing these exposure and increasing awareness of the harmful effects that these exposures have on individuals with MCS and individuals that have sensitivities that have not been diagnosed with it, but they will eventually or more likely to develop, respiratory issues, asthma, MCS, and other diseases as well.
Hmm. Yeah. And in your work, you've studied the social and environmental determinants of health. How can we better support individuals with MCS from a social and institutional standpoint to help reduce their exposure to harmful chemicals?
Supporting individuals with MCS is a must. It's a duty. We all have to do it. This is part of being a human, and it requires a multifaceted approach. So, socially, we need to increase awareness of MCS and its impacts to reduce stigma and create supportive networks. Often, people that are diagnosed with MCS that are in an environment that where they're feeling the sensitivities and feeling that they're not able to breathe or headaches or whatever symptoms they're having are dismissed because there are symptoms that are not really felt by others. So it is important to reduce that stigma and increase awareness of it so that they can have those supportive networks. Now, institutionally, implementing workplace accommodations, enhancing building ventilation systems, establishing chemical-free zones in public places are essential steps to support those individuals. So there needs to be policies and guidelines to reduce exposure to these chemicals, to prevent those individuals from having environments that are harmful for them. Policies that mandate, for example, the use of safer chemicals in products and environments, or buying safer chemicals and products and environments because they do exist, but knowing how to identify those products and then purchasing them at the institutional level. This can play a pivotal role in minimizing exposures for individuals with MCS. So whether it's at the social level, at the institutional level, and then at the policy level, the highest policies, these are really important to protect the environment of individuals that have multiple chemical sensitivity.
Yeah, thank you. And I see that one day at a time, more and more policies are being put into play. More and more institutions are starting to uh, go the fragrance free route. So, one day at a time, we're chipping away at it, and hopefully
Change is
we'll get,
slow.
yeah, change is slow, but some of the big institutions and big local banks and airlines are starting to adopt scent-free policies and asking for training. So I think it also goes with their staff, right? And recently, a study has been done that these older aircrafts they bring in air from outside,
Mhm.
recirculate it into the cabin, and newer planes are designed without this function. So that means there's definitely, from a manufacturing point of view, something that's stopping this science from going forward in the sense where the airplane manufacturers know that bringing this air in from outside is also mixing it with the combustion of the engines, so it's bringing in a lot of pollutants into the cabin. So these are all things that add up in the long term, right?
And need to change. And it's the
And need
same
to change it.
situation when we're living in cold countries in the winter month, not a lot of ventilation's happening. So if there are no policies in big buildings, institutions, that air is just circulating inside and it's creating an environment that's not healthy and detrimental for certain individuals, especially those with MCS.
Oh yeah, yeah. And can you speak of the significance of creating awareness around environmental health issues in schools, workplaces, and public spaces, especially for those affected by MCS?
So going from what we were saying, because change is slow in some cases, policies are not adopted to create that environment. Creating awareness is key. It is important to create awareness in schools, workplaces, public places. It's vital for fostering inclusive environments. So, educational initiatives, for example, can help individuals understand the health impacts of environmental toxins and encourage the adoption of safer practices. For individuals with MCS, this awareness can lead to practical accommodations that can be done, such as implementing fragrance-free policies, improving ventilation, reducing the use of harmful chemicals in workplaces and educational institutions. So, promoting environmental health literacy overall empowers communities to advocate for healthier and more inclusive spaces for everyone. And so that is a key forward where, creating awareness and creating a better literacy when it comes to environmental health is able to move things forward for the time being until other policies are put in place and more industries are aware of this situation and, promoting the use of these less toxic products.
Yeah. I mean, this is where my next question goes right back to policies, and I know we're touching a bit on it, and like in your opinion, how could public health systems and policies better address the needs of people with MCS, given the increasing awareness of chemical sensitivities and environmental pollutants?
That's a very important question because I've focused so far, like in the previous question that you asked, on creating awareness and empowering communities. But public health systems are super important. They are in place to play a role. So they can better address the needs of individuals with MCS by first recognizing MCS as a legitimate condition and then integrating it into their health policies. So this includes doing more research or funding for research on chemical sensitivities, establishing guidelines for chemical exposure limits. Currently, we don't have many for a lot of the toxins that impact people with MCS, whether it's parabens or phthalates. We lack those guidelines. So establishing some type of guidelines for chemical exposure limits, promoting safer alternatives in consumer products, these are all important tasks that can be done by public health systems. Now, policies should also emphasize accessibility by mandating fragrance-free and low volatile organic compounds, chemicals, environments in public places and workplaces. It's essential that we use low VOCs and we implement scent-free policies so that individuals can be protected and their health can be protected. So collaboration between policymakers, researchers, advocacy groups is essential to ensure that the voices of individuals that have those multiple chemical sensitivity or that have other respiratory health problems that also are impacted by those chemicals, that their voices are heard and their needs are addressed.
Thank you so much. That's some great information. Thank you. Attention to all our listeners. Hi, everyone. We'll be right back after this short announcement. As always, thanks for tuning in to this episode of Footprints and Impacts. If you're passionate about improving awareness and advancing research on multiple chemical sensitivity, MCS, mark your calendars for May 1st and May 2nd, 2025. That's May 1st and May 2nd, 2025. Come join us at the Resilience International Conference on MCS, hosted by the Environmental Health Associations of Quebec and Canada. This virtual event will bring together top researchers, advocates, and global experts to share groundbreaking insights and discuss the future of MCS research, healthcare, and advocacy. Day 1 dives into the latest findings on the biological and cellular mechanisms of MCS, while Day 2 tackles global challenges from stigma and bias to collaboration with international organizations like the UN. This conference is fully online via Zoom Participate from anywhere. It's accessible with ASL, LSQ, and multilingual captioning, interdisciplinary dialogue with experts across medicine, bioethics, law, and more. Together, we can definitely make a difference, so don't miss out on this powerful event. Your voice and support can drive real change for those affected by MCS. For more info, check out the links in the description of this podcast, visit our websites and our socials. The registration link will be available on our Instagram, Facebook, and LinkedIn pages, as well as on Zeffy. That's Zeffy. Together, we could build a more inclusive and resilient world for people with MCS. See you there. So you're currently working on projects involving women's knowledge and perceptions of toxin exposures. How does this research intersect with the experiences of women with MCS, and what are what are the key findings so far?
Yeah, thank you for this question. So, we know that women often have higher exposures to environmental toxins due to their use of, household products or personal care products, more than males in general. Many of these products have harmful chemicals in them. So, a key finding from our research revealed that despite participants reporting a prevalence of 20% for chemical sensitivity, and we were not looking for that. It was just one question in a survey that we sent if individuals have been diagnosed or if someone from their family household has been diagnosed with chemical sensitivity, and 20% said that they were, so either themselves or their family member. So that is a key finding. And despite that, what we saw from our survey is that some women had never heard of the risks associated with harmful chemicals prior to the study. And some of these chemicals are very much reported and on products as well. So parabens, phthalates, lead, triglycerin, many of them had never heard of these chemicals. So there's a disconnect, and this disconnect highlights a significant gap in awareness, and it underscores the need for effective knowledge dissemination. When participants were provided with information about these risks, it significantly influenced their behavior. So we did a follow-up study where we introduced a toolkit to a cohort of individuals, and we told them about the risks of these chemical products, and then we monitored their behavior. And what we found that now that they know, it significantly influenced their behavior, and it prompted them to make safer choices. So when we're looking at specifically women that are diagnosed with MCS or that experience multiple chemical sensitivity, these challenges are even more critical, as even minimal exposures can trigger severe reactions. So it's important to be aware of that and have a support network around them that is aware of those severe reactions so that better environments are promoted. So the research that I've done emphasizes the urgent need for targeted education, accessible, safer alternatives to products with these chemicals, and stronger regulation to protect women's health, particularly for those with heightened sensitivities. So we're, circling back to social aspect of it. We want to let people know, and people need to be aware of those health effects, but also at the institutional level and at the policy level, more work needs to be done to protect those individuals and other individuals that are affected by these chemicals.
Yes, thank you. And I mean, the list grows more and more, and there's more and more groups that are sharing these newfound knowledges, be it on black plastics, be it on women's hygiene products.
Mm.
There's so much garbage in these products, and like they've been getting away with it for years, and sometimes it even makes you ask, why are you putting these products in or these ingredients in your products, you know? And
And when media catches, wind of it, it
mhm,
people know they change their behavior, which helps, right? But at the policy level, things need to be done to protect the health of individuals.
mhm. Oh yeah, I think that's where the first step has to come in, is if you're going to be putting a product on the market and you want to have certain ingredients in it, then it needs to be labeled. There has to be some kind of a warning sign. You know, like cigarettes have warning signs now. Apparently, even alcohol is going to start having warning signs on them. So I mean, there should be the same signs on beauty products, scented products. You know, even
Hygiene
toys,
products as
yeah,
well.
hygiene,
Yeah.
yeah, even toys. You know,
Yeah.
like there's a lot of toys out there that have a long list of PFAS chemicals in them, and kids are playing with them, and the rest is history,
Unfortunately.
like they
Yeah.
say. Yeah. So yeah, it's a changing world, but at least now the world is way more communicative, where people talk about
Hmm.
experiences and people ask a lot of questions nowadays. I think that's the core of it. So going back to my questions, the connection between environmental health and MCS is critical, yet often overlooked. How do you think advocacy could play a role in raising awareness about MCS and its links to environmental factors?
Advocacy is essential for bringing visibility to MCS and its environmental links. So, advocacy efforts can include public health campaigns, public awareness campaigns, policy lobbying, and then collaboration with organizations to promote safer practices, to also promote research that can inform what are the safer practices that population or individuals in certain populations can take. So these initiatives can help educate the public about the condition. They can reduce the stigma related to those individuals that have MCS, and they can encourage systemic changes that prioritize the health and well-being of individuals with multiple chemical sensitivity. So advocacy also empowers individuals to take control of their environments and to demand healthier, more inclusive spaces. Feeling inclusive is a must, right? Like to have control of their environments and not be dismissed. That would create an environment for those with MCS to be empowered, right? And then make changes to their environments and then hopefully live a healthier or better quality of life, given, what they are facing.
Thank you. And finally, Dr. Barakat, what advice would you give to individuals newly diagnosed with MCS, particularly in terms of managing environmental risks and navigating their daily lives?
This is a hard question. It's hard. Dealing with a new situation is often challenging for many. So, for individuals newly diagnosed with MCS, my advice would be to prioritize creating a safe and supportive environment. So, making sure or working on having an environment that's health conducive for them, right? So ensuring scent-free products, improving home ventilation, trying to identify potential triggers, just living a healthier lifestyle. What sort of personal products are they buying? Household products, furniture? What are their triggers that are causing this situation to this health outcome to develop or to flare, and try to improve this environment. It's easier said than done, unfortunately, for many. Another advice that I want to give them is to work towards building a strong support network of family and friends and healthcare professionals, because that is crucial. We cannot live in isolation. And unfortunately, with a condition like MCS, it becomes hard for individuals to attend functions, birthday parties, weddings, or whatnot. So, what can be done? It is important to build that support network of family and friends that understand what is happening and help in creating a better environment. Healthcare is essential for individuals with MCS. So, how do they look for the healthcare that they need? Where also this is a place that's conducive to their health, not a place that they can't attend because it is not offering, let's say, scent-free environments. So I would encourage them to stay informed about environmental health, to advocate for accommodations in their workplaces, in public places, in their healthcare clinics, for example, and amongst their friends and family. Um, it is important to keep them part of the community, included in a community. And it is important to remember as well that for individuals with MCS, it's a journey, but with the right resources and support, it is likely possible to manage those sensitivities and improve the quality of life. Advocate, right? Be part of those advocacy groups, and sometimes it also involves educating the healthcare professionals themselves of that condition, so that they're better accommodated, and then they can seek the help that they need. It's sometimes easier said than done, as I said, but this is my advice to those individuals that are experiencing some sort of sensitivity. And as I mentioned, in many cases, it goes, and if it's not really, significant, it may go unnoticed, and people are not aware of their triggers or what's causing, the different health outcomes, whether it's migraines or whether it's not feeling fatigued, because there's not a lot of awareness about this condition at every level, even in the healthcare world as well.
Yeah.
But it's important to have people like you put these things on podcasts and more
Yeah,
research
and talk about
and
it.
yeah, more dissemination to increase awareness.
So, Dr. Barakat, you'll be speaking at the Resilience Conference, the international conference on multiple chemical sensitivity. Um, how do you feel about giving a speech or talking at such a big conference internationally?
So, part of my job is to disseminate the research that I do. So it's from that end, I'm happy that we have research related to chemicals and chemical sensitivities, and we are going to be disseminating those results at the Resilience Conference. But from the other end, I'm really excited about that event, not only for sharing my research and my findings, as well as research that I have undertaken with my students. So I have a research team, and there's several projects that we're going to be um, talking about, basically, and introducing the results to. But I'm happy that it's the size of the event or who is there. There's a lot of stakeholders in there. So there's the policymakers, there's the medical professionals that are going to be talking about the biological aspects of the disease. So looking at it as an event, it is an exciting event to be part of, because the awareness or the outcomes of that event are going to target different aspects, spreading awareness about the biological nature of the disease, the of MCS and the condition, the symptoms, how it relates to individuals, their lived experiences, and then moving into how the environment can be better protected for those individuals. This is where I fit in, but I'm really excited to be part of that event, and I'm looking forward for it. And I do encourage everyone that wants to learn more about this event to attend. You don't have to have multiple chemical sensitivity or have someone diagnosed with it to attend. It is knowledge for everyone to have. So I'm really excited about that event, and I encourage everyone to attend.
Thank you. And you mentioned one of your students will be speaking as well as the event. Is there anything you want to say about that?
So again, part of my job, I do have several graduate students that work with me on the research projects. One of my students has moved on to study medicine. So she's a medical student, and she's also involved in a research project that's looking at the lived experiences of individuals with MCS. So I'm excited as well to have her part of that event. And the research that, we've worked on together and the findings are very interesting. And there are findings that need to be widely disseminated. So we're happy to introduce them at this event, but we're also looking at publication in peer-reviewed journals and academic journals as a follow-up, so that this knowledge is widely shared within the academic community as well.
Perfect. Thank you. And this resilience event takes place on May 1st and May 2nd. I know we have a mid-roll ad playing during the episode, so all the information will be there, but you can always find the information on the Environmental Health Association of Canada's website or the Environmental Health Association of Quebec's website. So that's May 1st and 2nd, 2025, and it gathers researchers, advocates, experts, and perspectives from all around the world. So we look forward to seeing you at the event. And any final thoughts? Like, what do you see the future for MCS or environmental health? What's your view on the long term, short term,
I'm
long term, let's say?
Yeah, I'm an optimistic person, so I'm hoping for change. I hope change is at the highest level where it comes to, like you said, one of the things that you were saying is like before things are put, like products are put on shelves or made available to individuals, testing needs to be done. This is often where we lack, um, uh, you know, uh, where we lack in terms of how to make things available for individuals. So market drives a lot of our choices. Things are up on the shelf, people buy them, but things should be tested before they're put out on the market, whether it's personal care products, construction material, tampons, hygiene products, creams, masks, household chemicals, all that. I hope change is done at the highest level as well. And it is important for individuals to be aware that many products are not really tested for these potential toxins or those harmful chemicals. So we need to be aware of these products, and that's where my research is focusing on.
Thank you. Thank you so much for sharing today. And I think this was a great podcast. I think our audience definitely got a lot of good information, especially coming from a health professional, from a professor. It's always more reassuring. So, Dr. Barakat, thank you so much for sharing your expertise and insights with us today. Your work is helping to shed light on the complex relationship between environmental exposures and health, and it's crucial for raising awareness about conditions like MCS. We appreciate the invaluable perspective you've provided, and we look forward to seeing how your research will continue to drive positive change. To our listeners, be sure to take some time to reflect on today's conversation, and let's keep working together to create a healthier, more supportive environment for everybody. And thank you for tuning in to Footprints and Impacts. Until next time, stay informed and take care. Dr. Barakat, if you want to say goodbye to our guests.
Thank you so much, Marco. And again, on my part, thank you so much for tuning in. And it was a pleasure to be with you on Footprints and Impacts. And good luck. Just stay informed.
Yeah, thank you, and hopefully we'll see you again in the near future for some more in-depth conversation.
Thank you so much, Marco.
Thank you. Thanks for tuning in to this episode of Footprints and Impacts. If you found value in today's conversation, be sure to subscribe, leave a comment, and share it with friends, family, and especially someone who might benefit. Don't forget to follow our upcoming episodes for more insights on sustainability, health, inclusion, and how we can all make a positive environmental impact. Until next time, stay curious, take care of yourself, and be well.
This podcast is part of the Empowering Community and Removal of Barriers project, funded in part by the Government of Canada's Social Development Partnerships Program, Disability Component.